I'm Rusty Hofmann, Professor in Chief of Interventional Radiology and Medical Director of Cardiac and Interventional Services and Medical Director of Digital Healthcare Integration at Stanford Healthcare. The purpose of this project is to be able to take video visit interactions from patients that are suffering from upper respiratory tract infections, most notably COVID, but could also be influenza, and collect enough of that data, video visit data, to develop an AI algorithm that when a patient looks into their smartphone or into their computer, within 3 to 5 seconds, the computer would understand how sick this person is and be able to help triage that patient in queues, either for video visits or queues in lines at the emergency room, or even very rural settings in third world countries where they don't have trained medical professionals to make decisions on whether to escalate care and transport patients long distances to be admitted to a hospital. At a very high level, we're going to be able to determine whether patients are sick or not sick by using an AI algorithm. Really, as you want to get a level deeper in deployment of this in a healthcare system, is really what are the intrinsic biases? Does this algorithm treat people of color differently than white people? Does it work better on children versus adults? Does it work better on high fidelity technology versus low fidelity technology? And so really this is like the starting point of determining sick versus not sick in the training set. But as you start deploying across different populations, you have to be incredibly careful about looking at what biases occur. And that's another fruitful area for research here at Stanford. I'm really excited about the success of this project long term. Instead of putting doctors and nurses on planes and flying them across the world to look at patients in clinics that come to that clinic, if we had technology that is simple as a cheap smartphone with a very straightforward algorithm with very low computing power that these people in these villages could use to determine whether they need to go to the next bigger village for better care than they're currently receiving. When you think about that, that really helps them get the care they need, but also helps them preserve their very few resources they have actually to just continue sustaining a life in their small village.